Hi, I'm Michelle Lyons and I'm coming to you live from Ireland for now. I'm very much looking forward to coming to Australia to meet you next month on my trip to talk about all sorts of things down under. We're going to be starting with a course on advanced urogynecology, looking at going quite deep with the anatomy, form and function of female pelvic health, and really looking at how we can incorporate our MSK and orthopaedic skills along with myofascial release, visceral release, lymphatic drainage, to really tackle some of the problems women face with the many different diagnoses that fall under the umbrella of pelvic pain. We're also going to be talking in another course in another city about advanced management strategies for pregnancy and postpartum, and we're going to look at how we can integrate our tailored exercise prescription skills along with our manual therapy for helping women not just survive and endure pregnancy, but actually be able to enjoy it, and how we can best help prepare them for labour and delivery. And then on day 2 of that course, we're going to spend a lot of time talking about postpartum rehab. What happens after you have a vaginal delivery or an episiotomy or a C-section, and what we can do to really help women get back on track and get back to enjoying their lives, all the while taking care of a new baby. Then we're going to move on and we're going to have a couple of one-day masterclasses. The first masterclass is going to be on a subject that's very dear to my heart, gynae cancer. September is Gynae Cancer Awareness Month. So we're going to look at the growing body of evidence about how skilled physiotherapy can really help women with all sorts of pelvic dysfunctions, but general systemic dysfunctions after they've had treatment for pelvic cancers. Treatments like surgery, radiation and chemotherapy, and of course all the hormonal therapies really have led to a lot of advances in how we treat gynae cancers, but there's always a price to be paid, and we're going to look at how skilled physio intervention can really help these women. And then we're going to finish up with a masterclass on the menopause and how physiotherapy has a huge role to play here as well, helping women deal with some of the challenges around bone health, around pelvic health, because once our hormone levels start to change at perimenopause, then it can mean that we need to think a little bit more focused about prolapse, sexual health, urinary dysfunction, and also back pain, and how our changing hormone profiles, are going to really influence how we as physios help these women. We're going to talk a lot about integrative healthcare, how we can look at managing lifestyles. It's not just when you come to physio for your 1 or 2 sessions a week. It's about how we can really help educate and motivate women to make lifestyle changes that are going to help move them towards optimal health. I'm really looking forward to seeing you in Australia next month. I want to thank Fiona Rogers for inviting me over and organising everything. And if you've got any questions about registering for these courses, then contact her at pelvicfloorexercise.com.au. Looking forward to seeing you then. Bye bye.